Well, I was participating in a focus group that was called Health Project, and I was there as the father of a 33-year-old girl who has got autism spectrum disorders. I was not just the only father working there were other parents, and what I am going to do here is basically try to summarize some of the opinions that were given by these parents in that focus group. Basically opinions that refer to psychiatry and certain psychiatrical elements that refer to autism spectrum disorders. In this focus group, we were able to deal with many different topics. Topics that refer to the problems and challenges that parents find whenever they have a person with autism spectrum disorders. One of the problems that we were able to identify was precisely that diagnosis is not always a simple thing. Probably, if you are a father or a mother with a person with this kind of condition, you will have an experience in which you found it very complicated to find a professional, a doctor, a psychiatrist who were able to tell you your son, your daughter has got autism. So this is the first problem that we as parents had. And the challenge is precisely to find professionals that are able to really understand what the characteristics of autism are and how to really identify people that have autism at a very early age. We are all aware that the sooner you are able to understand that a person has got autism, the better the treatment is going to be, and the better the outcome of the condition will be as well. So, as a father, and this is my personal experience, I really think that it is absolutely essential to be able to educate, to give the theoretical tools to professionals, to doctors, to psychiatrists, so that they are able to identify precisely the characteristics of this syndrome. We are not only talking about very young people with autism, children, we are also talking about adults. We shouldn't forget that in the past, not many years ago, we are talking about the end of the 20th century, it was really very complicated to find professionals who were able to diagnose this type of condition. And so nowadays, there are many adults that have autism, that have had autism for many years, and whose condition has not been understood in their lives. They have suffered the very negative consequences of this. Probably they had to face terrible experiences in their relationships with the community. They really didn't know what was going on with them, and their families didn't know either. So, to just really underline the importance of the challenge I am referring to, diagnosis is essential, not only for very young children, but also for adults who in the past didn't have the opportunity to be given a proper scientific diagnosis. And if we want to do that, we need professionals that are properly capacitated in order to do that. Because sometimes it's not that easy to really say you have autism, you don't have autism, you have another condition. So we need real experts. Perhaps some people can say, why is it so difficult to really, first of all, diagnose autism? And why is it so difficult to really understand what's going on with these people? Well, we have to really understand, first of all, that one of the characteristics of many of these people with autism spectrum disorders is that they have verbal and non-verbal inabilities. I mean, sometimes they are unable to express how they feel. Some of the times they are unable to say anything at all because they are unable to communicate. So for doctors, for professionals, it is a real problem to know what's going on with that patient because the patient cannot express what is happening to him or to her. We are talking about comorbidities. We are talking about physical and psychiatric problems. many people know that this type of people with autism have a very high prevalence of certain conditions that are also very serious. For example, if we speak about physical comorbidities, we can refer to gastrointestinal problems with very severe stress, with epilepsy. 30% of people with autism have epilepsy, but very often they are unable to say anything when they have a fit of epilepsy. So it is quite difficult to really know what's going on in their bodies when they are having a problem. But we can also refer to psychiatric problems, depression, anxiety. When a person is unable to express properly what is going on within his or her body, his or her mind, frustration arises. And if there is frustration, probably a consequence of that frustration will be depression, will be anxiety. And how can these people express their anxiety? They cannot say, I am anxious, I am nervous. What they are going to do probably is, I am going to develop certain types of aggression to other people, to myself. So this type of behavior is going to be extremely strange for people who don't understand the syndrome. And sometimes doctors, they really don't know what autism is like, will try to find medical solutions that are not appropriate for what is going on, because they really don't know that what is happening really is a depression, is anxiety, not just the fact that they are violent. They are not violent. They feel violence inside and they are unable to express it. So what can we do to really address this very challenging problem? What we need is, or are, professionals, in this case psychiatrists, who are with these people working constantly on a daily basis in relationship with the group of professionals that are constantly assisting these people with autism, that are working with nurses, with the psychologists, with speech therapists, with the occupational therapists that are working with people with autism. So that whenever there is a disorder, a behavior that is incomprehensible, they can understand what is going on inside that person, because they know the person, not just in that moment, but they have known that person for a long time, they have been treating them for a long time, not just giving medications once or twice every year, but really following the development of that personality that is extremely complex. So, what I am trying to emphasize basically is that if we want psychiatrist attention or assistance to be fruitful, we need this attention, this assistance to be constant, to be permanent, not just happen twice a year, 3 times a year, in a hospital, not in the place where these people are living. So we need a better collaboration, a narrower, stronger collaboration with these professionals. We are talking about psychiatric problems. This is something we cannot say if the psychiatric problem happens. We cannot say if. We should say when, because we can be sure that sooner or later this type of problems will arise. There will be a moment in which a person with autism will be depressed and will stop eating or will not eat properly, or will have sleeping disorders. There will be a moment in which anxiety will not be controllable in their family environment and they will need to go to a hospital. Let's think about the personality of the majority of people with autism. One of the basic characteristics of this syndrome is that they are unable, or they find it very difficult, to live in environments which are not the environment where they are normally living. So now let's imagine a person with autism that is having a problem, a serious physical problem, that has to have an operation or a psychiatric problem, whatever. that has to be taken to a hospital, taken out of their comfort zone, the place where they feel better, where they understand what's going on, taken into a building where there are thousands of people, where they are going to suffer painful treatments, where they are going to be touched by people they don't know or understand. Their psychological chaos will be absolute. So, for me as a father, and I've had this experience not because of a psychiatric problem, but a physical problem. My daughter was taken to hospital to undergo a very simple operation in her mouth, but she had to be anesthetized. And when she woke up again and she saw herself in the middle of a place she didn't know or understand at all, the situation was really terrible. So what I'm trying to say is that if our children are in a hospital, they need to be in an atmosphere that can be controllable. The only way to have that is to enjoy the collaboration of doctors, nurses working in that hospital. If we are talking about psychiatric problems, we need the collaboration of the professionals working in the psychiatric section. We need to have rooms which are not so aggressive or so cold as the rooms of a hospital, rooms which are made for people with autism. We need to have professionals who really understand how to communicate with these people. Because if you as a doctor try to speak a lot, or you as a nurse try to be very kind and friendly and touch this person a lot, maybe the condition is going to get worse. So you need as a professional to know how to deal with people with autism. For that reason, before the problem arises, before the person with autism is taken to hospital, we need hospitals which are ready and prepared with specific rooms, some professionals who know what they are talking about, and also we need openness. We need public sector professionals who are ready and willing to collaborate with the professionals that we have in our associations, because our professionals know exactly the personality of the people they are working with every day, and our professionals can really give very productive and very fruitful inputs to the professionals working in hospitals. So perhaps in summary, the word that could really underline what I'm trying to say is that collaboration is absolutely of paramount importance. Collaboration between the public sector, the healthcare system, and the private sector of the associations, where, although they are private, they really know what they are doing. They are working every day with these people. They have a lot of expertise that they can share with the wonderful professionals in the public sector. So collaborations in terms of equality and the fact that the public sector has to understand that people with autism are not special. They are a little bit different. They need a kind of treatment with certain specific characteristics, not very difficult to get, very simple. But if we have this a specific design in an area in the hospital, the treatment will be better, and the experience for the person with autism will be much less traumatic.